Welcome to Forum 360 with its global outlook and local view. Our topic is the Axess Pointe Community Health Centers. And our guest is Chris Richardson, who is their Chief Executive Officer. Hi, Chris.
Hi, Ardith.
They are commonly known as Axess Pointe Clinics. And I'd like to ask Chris to explain it all to us. What are Axess Pointe Community Health Centers?
Yes. Well, Axess Pointe Community Health Centers is a federally qualified health center that has been around since 1995. Our charge is simple. It's providing quality, affordable health care to the residents of Summit and Porch County. Our services include medical, dental, pharmacy, and behavioral health, and also some ancillary services such as our personal hygiene closet and food as medicine program. Our goal is to make sure that we serve residents from cradle to grave, making sure that they leave our clinics feeling better than when they walked in our doors.
It's commonly called a one-stop shop. What does that mean?
It means everything is inclusive in one space. So it's contiguous space that allows for patients to navigate from one specific area of our facility to the next specific area in our facility, as opposed to going cross town or to another location to receive those services. So it's awesome when you can come to a location where you can get your medical care, you can go to dental, you can get your prescription medications, or if you need behavioral health services, all under one roof.
That sounds pretty good to me. When we'll talk more about some of those services, but does the center have any partners?
Yes, so we have multiple community partners. Summit County Public Health, our three major hospital systems in Summit County and the one in Portage. So we have Akron Children's Hospital, we have SUMA, we have Cleveland Clinic, Akron General, and University Hospitals in Portage County. You know, it's such a great partnership to have with our health departments and hospital systems, simply because we have the privilege of serving the same patients. But it's also knowing that we all have our specific areas of expertise that we can offer to our residents to make sure that they have their needs met and can live a healthy and sustainable life.
Do you have financial support from the federal government or from anyone else?
Yes, the Health Resources Services Administration provides us with base grant funding every year, which allows for us to take care of salaries for the many providers that we have, from our dentist to our dental hygienist to our nurses, our nurse pracs, and our family physicians. And so in addition to that base grant funding, we also get funding for new Axess Pointe grants, which would allow for us to build and develop a new health center in an underserved area. In addition to that, we also receive quality grants every year. So quality grants based off of how are we making the grade when it comes to those clinical quality measures. And also, in light of the COVID-19 pandemic, we also got some funding recently to help build some capacity and infrastructure, which will allow for us to provide that testing to the much deserving residents of Summit and Portage County.
You've been called an FQHC. What is that?
Yes, so a federally qualified health center goes back 60 years ago, and this is under Lyndon B. Johnson's administration, and it was his war on poverty. He wanted to see that those who are living in poverty and those who are medically underserved could get access to quality, affordable care. And so things like Head Start came under his administration, as well as the federally qualified health center model. His charge was to make sure that people could get world-class care in these facilities that would allow for them to get care, and that regardless of their inability to pay, they would still receive that care. And so we see patients on a sliding fee scale based off family size and income. If they have insurance, whether it be Medicaid or commercial insurance, we can see them. But the goal is to make sure that cost never becomes a barrier. And that sometimes can become a challenge in some of these medically underserved neighborhoods. And so for us, it's a privilege to be able to provide world-class care and to make sure that the burden of financial cost does not become an issue for our residents.
You've been in existence for 25 years, and I know this is a special anniversary, which we'll also talk about.
Yes.
But why have some of our audience never heard of you?
Yeah, we're almost like the best kept secret, and that's not always a good thing when it comes to knowing that we can provide health care to our residents in Summit and Portage County. I think a lot of it has to do with just awareness. There's marketing strategies in terms of spreading the word, and a lot of our patients, they hear about us by word of mouth from someone else. But I also think it is how we're sometimes just perceived. I mean, there is some stigma, unfortunately, that comes with the FQHC model, even as such as having conversations with individuals who will say, oh, well, that health center is for those people, or I don't know what they do there. I hear they do this, I hear they do that, but they really just can't put their finger on the pulse of what we do. So for myself, for my colleagues, it really is about bringing that awareness to community partners and to people who need that health care to let them know what we're doing. Our existence started with two individuals, Dr. William Keck, who was past health commissioner of Akron City Health Department, and Ralph Faulkner Jr., who was a Cleveland State graduate. Those two had a specific zip code in Akron designated as a medically underserved area. And through, after several attempts, they were able to get some funding to designate and have the first health center, or FQHC, if you will, in Summit County. And so 25 years later, Ardith, I think it's a blessing that we're still here in this community, that we've made an impact, but we have so much more work to do. And I can see the potential of this organization. I know Dr. Keck and Ralph Faulkner are very happy about this organization still being in play today, but we've got some work to do, because we know that there are hundreds of thousands of individuals who still don't have access to healthcare, who still don't know about this gem in the community.
You're kind of like Forum 360, this program. We need an advertising campaign to let people know we're here. And I would say Access Pointe may be kind of the same.
Yes.
To let people know you are there.
Absolutely.
You do wonderful things. You've mentioned that you can serve a lot of people. Anybody?
Anybody. Doesn't matter. I mean, the premise of the FQHC model, the Federally Qualified Health Center model, is to make sure that anyone gets access to care, regardless of your economic status or what you look like. So, our goal is to make sure that we can treat people from cradle to grave. Families can come in here and get their needs met. They don't have to go bouncing from one clinic to another to get their preventative care needs met. And so, I mentioned earlier about the hospital systems. They specialize in so many different things, from cardiology to neurology to podiatry. But it's so important that our communities focus on the importance of taking care of your health from day one, from your oral health care to your mental health, to making sure that you're getting the proper testing, that children are getting their vaccines appropriately. And so we're about making sure that individual has a medical home that they can come to on a regular basis. And the hope is that they'll live a long and sustainable life.
Where are you located?
Yeah, so we have 5 locations. So Arlington Street, 1400 South Arlington Street, Suite 38 is our first location in Akron, Ohio. And then we have a location in Barberton at 390 Robinson Avenue, Suite E. And then we have another location on Broadway at 676 South Broadway Street. In that clinic space, we have internal medicine, and we also have a women's health clinic. That's in partnership with Cleveland Clinic Akron General. It's a residency clinic. And we also have a location in Kent at 143 Gogler Avenue. And then lastly, we have a location inside of Porch Path at 340 South Broadway Street.
And a couple of those are not open during COVID-19.
Well, so for a brief step, the Porch Path location had been closed because we were actually embedded inside of Porch Path, which is a mental health agency. But that has, just in the past month, we actually reopened in that location. And so all of our sites are open for business.
All right, okay. You are not a free clinic, and I notice in all of your publications, you stress that you are not a free clinic. How do people pay? You mentioned the sliding scale.
Yeah. So they can come in and pay by, based on the sliding fee scale, based off family size and income for any of the services that I've mentioned. if they have Medicaid, their Medicaid can pay for the cost of their care, or if we get someone that comes in with commercial insurance. Now, I will say there are times when people come in here, Ardith, and they won't have any insurance. And they're asking, how do I get enrolled? Well, we have certified application counselors who will sit with them, who will educate, who will inform them about the best insurance for themselves and for their family members. We're able to get them enrolled, and they are then able to get an insurance. So it's really amazing to be able to have an individual or individuals come in feeling like, wow, I don't know what else to do, and we can really help them and have them feeling more empowered because now they have insurance.
Wow, that's a biggie. That
Yes.
is a biggie in this day and age. Have you made changes to accommodate the problems with COVID-19, with the virus?
Absolutely. You know, going back to March, you know, the first thing I thought about is access, you know, and the fear that our residents must have felt and still feel because they don't want to go out and risk getting this disease. And so with the support of my executive team, quickly put together an action plan in terms of what we're going to do. So we implemented telehealth within 1 week of the stay-at-home order. We then got all that information out on social media, through our EHR system to make sure that our patients knew that we're still open for business and that if you don't want to come in, we understand that, but we do have telehealth services. And so we started to see our face-to-face encounters decline, but we started to see those telehealth visits increase.
Can you describe telehealth?
Yeah, so it's basically a way for the patient and the provider to communicate through the use of either your mobile device or either just talking on the phone with that provider. And so we literally would set up a link for that patient to contact the provider. And so there's that FaceTime capability, much like you and I are talking right now, or the patient could actually just talk to the provider on the phone, but it allows for that provider to triage that patient to make sure that their care and their needs are still met. It also allows for determination of if that provider says, you know, hey, Mrs. Smith, I need for you to come in and see me today because based off of your symptoms, it sounds like your diabetes could be out of control, or it sounds like your hypertension is concerning that we need to get you in for a visit. Now, when our patients come to our doors, we have our staff that are prepared to check their temperature from the moment they walk in and provide them with a facial mask. So that way they're not risking themselves or risking others when it comes to the COVID disease.
Mm-hmm.
So now what I've seen lately, Ardith, over the past 3 months, we've seen that pendulum swing now where we're starting to see more people come in for face-to-face encounters, and we're starting to see that telehealth decrease a little bit. And that's okay. That's a good sign of people feeling a little bit more comfortable to come in, to see their provider, to get their care met. I'm seeing that volume increase slightly, but we'll always have telehealth. I mean, this is something where we don't know what's going to happen over the next several months. Hopefully there'll be a vaccine quickly, but we definitely don't want a barrier when it comes to access for our patients with getting their needs met.
All right, we're talking today with Chris Richardson, who is the Chief Executive Officer for Axess Pointe Community Health Centers. And we know that Axess Pointe has been in existence for 25 years. And I know you mentioned, Chris, that you have helped to people connecting to insurance to try to help them get covered. What about other social services? Are there connections for them?
Yes. So Akron Canton Food Bank is one. Job and Family Services is another. There's so many other partners that we work with that I can't even name. Because really when you talk about taking care of the whole patient, we are prepared to make sure that we can navigate that individual through the systems of care. We have community healthcare workers that will help an individual who might need a food card. They come in our facility and say, you know what, I need some assistance. I don't have a food card. I don't even know where I can find an apartment. Our community healthcare workers can contact Job and Family Services, or they can contact Akron Metropolitan Housing Authority or Portage County Metropolitan Housing Authority and assist that individual in getting their needs met. You know, when you talk about social determinants of health, these are things such as housing, access to fresh fruits and vegetables, even living in an area where you can go out and just enjoy nature versus being in a crime infested area. All these things can impact one's ability to live a long life. There is that saying, the zip code you live in determines how long you live. And there's truth to that, because if you look at some of the mapping of where the individuals that we serve in some of the Portage County, there's areas that are not as healthy to live in for, you know, a mom or a dad or children, where if they go to certain other areas where there's playgrounds, or if it's you may have this nice big yard, or maybe there's access to fresh fruits and veggies or grocery stores. These are those things that can really help a person live a sustainable life. So for us, it's really about making sure that we can provide them with the resources and do whatever we can to empower them. This Food as Medicine program that we started last year really came about in terms of, you know, just seeing people say, hey, I can't get to a grocery store. I don't know what it is when the doctor tells me to eat healthy. So we have a partnership with Akron Canton Food Bank that allows for us to have a small supply of groceries in one area of our building, such that the doctor actually prescribes food for that individual. Here's your 2 or 3 days worth of groceries. Here's what I want you to eat. Now go ahead and go over to the Food as Medicine program. They'll give you your supplies of vegetables and other produce, and we'll see you back here in another week or two. By the way, we'll show you where are some places where you can get fresh fruits and vegetables using your EBT card, because people don't know. They don't know what they don't know. So our goal is to make sure that we can empower them and give them that knowledge. And so our many business partners, nonprofits, and hospitals and health systems have been great to work with. And this is really all about taking care of the people.
You mentioned the answer to this, and I just want to emphasize it. You serve all ages.
Yes, absolutely. And that is so amazing for us to be able to do that, because it really is about helping families. It's about making sure that people don't have struggles and challenges when it comes to getting their healthcare needs met, or if you want to get your child's needs met, have them come to our clinic space. This is the model of federally qualified health centers, where we have family nurse practitioners and family physicians who can treat individuals from cradle to grave. Our dentist can do the same, our dental hygienist. Of course, we have nurses, our pharmacists. It's all about treating not just the whole patient, but we're fortunate enough to treat the whole family. You know, where else can you go where you can get all your needs met for your entire family under one roof?
And I think the service that astounds me most is the dental service.
Yes.
To be able to have dental services in the same building as you have your medical care is
Yes.
amazing.
It really is. And it really is important for people to understand the importance of good oral health, whether it's kids getting dental sealants, or whether it's taking care of the extractions or getting their dental cleanings. And we also offer root canals as well. So it's all about taking care of the whole patient. I mean, it really is amazing to be a part of an organization that I consider to be bigger than myself, but it's a privilege to be a part of this. It really is awesome to be able to see families smiling and feeling better about themselves when they walk out our doors than when they walked in. Yeah.
You serve people with general primary care, but you also have nutrition information, nutrition education, OBGYN,
Yes.
well child services,
Yes.
pediatrics, and you mentioned the pharmacy. That's
Yes.
another big one.
Absolutely.
In the same building.
Yes, and absolutely. And I will say with our medications, we're able to pass savings on to our patients where they don't find that the cost becomes a hardship. You know, there's times and there are those stories where individuals will decide whether or not they're going to buy their groceries or can they afford to pay for their medications. And for us, we're able to get funding. There's funding savings that are passed on by way of the Health Resource Services Administration that allows for a patient to come in and get 90 days worth of medication at a price less than $10, sometimes $5.
One of the quotes that I like best is where care and community meet.
Yes.
Where do your patients come from?
Our patients come from all over. So, we have, when you talk about the basis of a health center, there's a needs assessment that's done to determine what are areas within the region that there are medically underserved individuals. And so we have our surrounding zip codes, of course, that are based around our health center. And then also we get people that come from other counties. We've got 4 sites in Summit and 1 in Portage, but we get people that come from Cleveland. We get people that come from Trumbull County, Youngstown, Ohio. They'll drive over an hour to come to our services. And so the basis of the health center is to make sure that we are embedded in the communities where healthcare and access are a huge barrier. But through word of mouth, we get people that will come to us and say, I heard about you and you guys do some amazing work. Can you help meet my healthcare needs? And those always make me smile.
I bet. You mentioned a food
medicine.
Yes, that you have the capability of actually giving people food. But there also is a personal hygiene closet that you have.
Yes.
What is that?
Yeah, so the premise of the personal hygiene closet started with one of our staff who was meeting with a patient, a young lady, and she was talking with her mom, and the young lady was talking about personal hygiene products for feminine, feminine napkin hygiene products. And she said, Chris, we've got to do something more to make sure that we have these resources available, not just to our young ladies, but also to the adult where they don't have enough funds to carry them to the end of the month where they can afford shampoo, deodorant, lotion, your basic hygiene products. And so she started going out and talking with community partners who would be willing to donate, and also talk with some of the local schools. And some of the schools even sponsored our personal hygiene closet. And so what this does, this allows for a patient to, make the request, or sometimes they're not making the request, but through their interview and meeting with the provider, there's a determination that this person doesn't have enough of the hygiene products that are needed to help them to feel good about themselves and to take care of themselves. And so they go over to our personal hygiene closet, they grab what items they need, and it's just awesome to have that as another ancillary service for our patients. We're actually going to start expanding that to our other locations. Right now, we just have one personal hygiene closet, but we've also got some funding already in the works to establish 2 more, one at our Barberton location and one in our Kent location as well.
Fantastic. Are you looking for employees? It sounds like a good place to work.
Yeah, so we have, if you go to our website, www.axesspointe.org, AXESSPOINTE.org, we always have postings available, and so it varies. But we're always looking for nurses, of course, providers as well, sometimes front desk staff as well. And so if anyone's interested, they can go to our website, they'll see our postings, and they can get instruction as to how to apply from there.
How about donations?
Yes, we actually have a donation link on our website as well. We're more than willing to take donations, whether it be for our personal hygiene closet or if it's monetary. Certainly, it's interesting enough, Ardith, that there's times when people can't even pay their copays, and we get that. Sometimes we have to write off excess of $100,000 to $150,000 as a business to make sure that we're not putting that hardship on that individual. But that does leave us in presenting some challenges as well in terms of how we want to continue to sustain. And so when I'm having conversations with individuals who are asking how can they give, or what can they give to, I speak to our personal hygiene closet. I speak to the fact that, hey, if you want to give to the organization, a mom who comes in who has 3 or 4 kids, she may not be able to pay that $50 copay. So sometimes we have to write that off. So by them giving their donation, it can help us help another family as well. You know, we again, we're afforded the ability to get some dollars through the Health Resources Services Administration, but we're still a business at the end of the day, and we want to continue to do this work for decades to come. But if people are interested, they can go to the website.
And I mentioned that in the category of donations that you're having a gala, and you've had to switch that because of COVID-19. It's currently scheduled for October, and that will be a big fundraiser for you. But I thank you for joining us today. It looks like Axess Pointe Community Health Centers has at least another 25 years to go in the Akron area, and hopefully lots more. Yes. Thank you, Chris. This is Ardith Keck for Forum 360, Global Outlook with a Local View.
Forum 360 is brought to you by John S. and James L. Knight Foundation, the Akron Community Foundation, Hudson Community Television, the Rubber City Radio Group, Shaw Jewish Community Center of Akron, Blue Green, Electric Impulse Communications, and Forum 360 supporters.